So you have to explain. We have this permanent injury. We have to explain to this jury why this person has pain or discomfort, picking up laundry or picking up their kid. In other words, all those ADLs we talked about. Why? And here's the explanation. When the body healed, first of all, when they had the injury, they went through 3 phases of healing. There's the inflammation phase, the repair and remodel phase. In the repair phase, the body produces 4 negative factors. Number 1, there's an increase in the number of nerves. Number 2, those nerves can get tangled within collagen. Number 3, those nerves fire at a lower threshold. Now, 2 things happen with the collagen or the soft tissue. It's type 3 collagen goes in there. It's weaker. It's only 75% as strong, and it's only 70% as elastic. Now, here's what happens. All the therapies we do are designed to not let that happen, to not let that patient heal where all of those factors happen. Now, to some degree, we did. But with this particular patient, after the treatment protocol, we found out that they were at MMI. They got so good, and that was it. There was no further improvement. Maximum medical improvement. We put the impairment to it. Now, what happens with this particular patient is they healed with abnormal joint motion, altered arthrokinematics, LMSI, etc. They healed with altered biomechanics. What does that mean? It means that they move abnormally. Now, here's what that means. There's 3 ranges of motion. There's active when you move fully. Then there's passive when you go in overpressure. And then there's what's called joint motion. Past overpressure, there's a little more motion. Those are the 3 ranges. So here's what happened. The patient healed wrong to some degree in each of those 4 categories. With the extra number of nerves, the nerves are tangled in the collagen, or the nerves are hypersensitive, the collagen's a little weaker, and it's not as elastic. So here's what happens to the patient when they heal permanently wrong. First, when they do their activities of daily living, whatever it is, working, bathing, showering, most of the time in active range of motion with our patients, the low impact injury patients, they'll be able to do active range of motion. When they go into overpressure motion, what happens? When they go into that overpressure motion, and why they have pain or discomfort is those nerves, the increased number of nerves. Well, number 1, there's more of those nerves. So just because there's more of them, there's more of a chance of them firing and causing pain, where the motion, when they did that motion before the injury, it would not have caused pain because there's not as many nerves. Number 2, those nerves fire at a lower threshold. In other words, when the patient could bend over before the injury and pick up that laundry, in other words, go into active range of motion, but overpressure, in other words, that's at the very end of movement. So they go to pick up that laundry or whatever the activity of daily living is that they listed. That's when there was more stress, and then those nerve fibers fired. Why did they fire? Because they healed at a lower threshold and were at the maximum stress point in overpressure. Number 3, you'll also have pain because that collagen that comes in a matrix. It doesn't come in aligned, it goes in random. Those nerve fibers get tangled in there. Most people have heard of nerves getting trapped in scar tissue. Well, that's exactly what happens. Those nerves get tangled in that matrix, and here's what happens. When the patient moves, if they just move a little, the matrix just moves a little. Well, if they just move a little with gross range of motion, it's typically not a problem. But the further that they move into that motion, the tighter that matrix pulls. The tighter the matrix pulls, it compresses those peripheral nerves, number 1. That causes pain. Number 2, the nerves are already firing at a low threshold. So you have 2 factors that are causing pain relative to the collagen now. Now, that's what causes pain and restrictions. Now, why people have re-exacerbations or why they're more prone to re-injure themselves is when they go through, they typically won't in the active range of motion because there's not as much stress. But at the very end of each motion, whether it's forward, backward, or left or right, there's way more stress involved. And what happens is, remember that type 3 collagen is only 70% as strong. So if you go and do the whole activity, the full activity 100% that you could do before the injury, but now it's only 70% as strong, now is when you have the likelihood. Now, again, it won't happen generally when it's not stressed, in other words, active range of motion, but when you go to stress it, that's when those that's when that tissue that's not as strong creates micro tears. And that is the most common reason for re-exacerbations. Why people who could do an activity before an injury now try to do the exact same activity but can't and actually have a setback. That's the number one reason for setbacks. The third thing that happens is, remember, that elastic tissue is only 30%, it's only 70% is elastic. So what does that mean to the patient? Again, if I'm just talking about active range of motion, there's not much stress in active range of motion. So typically they can do that. But when they go into the stress part of the range of motion, that's at the very end, that's called overpressure. When they go to the very end, they typically cannot. And the reason they cannot go to the end like they used to is because that type 3 collagen, whether it's in the neck or the low back, wherever they hurt themselves, is only 70% is elastic. And that's why they're stiffer. They can't do it. And so this is why when people heal, they have pain. This is why with their activities of daily living or hobbies, this is why the altered joints produces premature degenerative changes because of abnormal wear and tear, and that is the precursor to arthritis. But what happens from a patient standpoint is the patient goes and does an activity, whether it's work, sleep, bathing, or showering, and a lot of times the patient won't do the activity because it's painful. They'll stop from doing it, alter their behavior, or they'll take pain pills or muscle relaxers to stop the pain. But if they do try to do it, that's why they have pain, because it's the most stressful of the ranges of motion, increased nerve sensitivity, there's a lower threshold, and the nerves are trapped in the collagen. That's what causes the pain, and then that's why they also can have re-exacerbations. When they do that activity, there will be micro lesions because it's not as strong, and a lot of times they will never even be able to do the motion fully because they have decreased elasticity. And the most common way to know this is almost everybody has had an old injury. And you'll see with old injuries, you won't be able to move them as much. They're stiffer, more restricted, and when you do move them, they're typically painful. And that's exactly what happens and how the body heals.